Good morning and a happy new year, Trinidad and Tobago. Thank you for joining us for the Ministry of Health virtual media conference on the national COVID-19 response for 3rd January 2022. To provide you with the latest update, we have the Honorable Terence Dayal Singh, Minister of Health, and Dr. Miriam Abdul-Richards, Principal Medical Officer, Institutions. I am Al Alexander, Senior Corporate Communications Officer in the Ministry of Health, and I will moderate this morning's conference. We begin with Dr. Abdul-Richards, who will provide the latest clinical statistics from the parallel healthcare system. Dr. Richards, good morning.
Good morning. Thank you very much, Al. Good morning to the Honourable Minister. Good morning to members of the media and members of the viewing and listening population of Trinidad and Tobago. A happy New Year 2022 to each and every one of you and your families. This morning I will be providing a brief update on the status of the parallel healthcare system, as well as the clinical update number 957 as of 4 p.m. on the 2nd of January 2022. An additional 458 cases of COVID-19 were recorded in the last 24 hours. This has taken the total number of active positive cases to 15,479. The patients are distributed as follows: 463 patients in hospital, 163 patients in step-down facilities, and 14,395 persons in home self-isolation. Sadly, 31 additional persons succumbed to COVID-19, and the total number of deaths due to COVID-19 is now at 2,914. The Honourable Minister will provide details on the vaccination status of persons as part of our national vaccination drive, and I'd like to now present some information on the status of the parallel healthcare system. The trends that I'm going to speak about have been consistent since October 19, 2021, and that's a 76-day period. We continue to note a high demand for intensive care unit level beds across our accident and emergency departments and in the hospitals in our parallel healthcare system. As of this morning, there are 71 ICU beds that are fully operational in Trinidad and 9 in Tobago in the parallel healthcare system, and a further 29 in the accident and emergency departments. However, we have 6 out of 9 of those beds in Tobago being occupied as of this morning, and 69 out of the 71 beds in Trinidad being occupied. Our overall hospital occupancy continues to be high. It is at 70% this morning, and there are currently 640 patients in the parallel healthcare system, 471 in hospitals, and 169 in step-down facilities. At our accident and emergency departments, there are 161 patients currently receiving care for COVID-19, of which 28 are ICU level care patients. The overall percentage of persons who are not fully vaccinated continues to be high, and it is consistent at about 90% or more in the ICUs and in the accident and emergency departments. And this underscores and emphasizes the need for vaccination. I'd like to now provide some information and share with you the experiences in the accident and emergency departments. And again, these have been consistent. We continue to see persons presenting in a severely and critically ill state. We continue to see a significant number of persons with risk factors. That is, they are not fully vaccinated. They have coexisting medical conditions such as diabetes, asthma, cancers, hypertension. We continue to see those persons and their relatives contacting the ambulance service and then refusing admission, even after our physicians and our ambulance team, our transfer team, staffed by physicians, on the telephone, try their best to convince relatives. These persons often return 2 to 3 days later. And we have noted that in the initial call or upon the initial call, they would have been ward level, meaning that they would have been ill, requiring oxygen, but not at an ICU or HDU level. And this is very concerning for us because we are about saving lives at the Ministry of Health. Our team, that is our main objective for our team. And we want to give each and every one of you the best chance. If we continue along this trend, we will continue to see a high demand for ICU beds. Another cause for concern would be the predicted increase in the number of COVID-19 cases within the next week. This coincides with a 14 to 21 day period from the start of the increased movements for the Christmas festivities. And yes, we appreciate that many of you were fully vaccinated, but there has been increased movement, which really coincides and correlates with the Christmas season. We anticipate that there will be an increased number of cases, and again, we humbly request and we implore you to please seek medical attention early on in the course of any sort of symptoms that you may have. This is the only way forward, and this will give you a chance, and it will also reduce the demand on our ICU and HDU level care beds and all the supporting resources. We also predict an increased number of cases and an increased demand for care across the system based on the increases we tend to notice after the Christmas and New Year period. And that's been a historical trend even pre-COVID. So with those two factors aligned, we continue to prepare, we continue to try our very best to cope with the increased number of cases. However, we again ask you and we thank you for complying with the 3 W's, but we need each and every one of you to please take up on the offer of vaccination, take up on the offer of the booster shots. The Honourable Minister will provide much more details on these drives and the availability of these vaccines. Thank you very much for your attention, and please be safe.
Thank you very much, Dr. Abdul Richards. The Honourable Terence Jansen will now present the latest vaccination figures and provide an update on key developments regarding the national COVID-19 vaccination campaign.
Thank you very much. Good morning, Dr. Richards, ladies and gentlemen of the media, and all good people listening, wherever you are. First of all, a very happy new year to each and every one of you. May God's blessings be richly bestowed upon each and every one of us and Trinidad and Tobago as we continue into the 3rd year of fighting this global pandemic called COVID-19. The current vaccination figures up to OLSD, which would have been Friday 31st of December, 668,982 persons are now on their way to being fully vaccinated, which is 47.8% of the population. As far as boosters are concerned, 76,479 persons to date, combined with when we first started the additional first dose and boosters, but from today we'll just call it boosters from now on, and that will become apparent in a short while. 76,479. So these 76,000 odd persons now have the possible maximum level of immunity that can be provided by vaccination. That is very good for them, and I am happy for that. However, we still need to get more people boosted. We ask persons, look at the schedules that we have put out, and once you fall into the schedule, please go and get boosted. We will be rolling out by Wednesday or Thursday of this week the second monthly timetable for persons getting boosted from Saturday the 7th of January. This current booster program, I think, ends later on this week. And those who are waiting for their turn, please get boosted. If you would have missed your turn for various reasons, maybe you were ill out of the country and you still want to get boosted, once you fall into that category that were eligible to be boosted, please go and get boosted, especially now that the Omicron variant is literally taking over the world, and most countries it is now the dominant strain. We already have non-travel Omicron cases in Trinidad and Tobago, and as you see with the world experience, it is doubling every 2 to 3 days and is becoming the dominant strain around the world, and is already straining healthcare systems around the world. It is crippling the airline industry around the world. It is crippling the cruise ship industries around the world, entertainment, everything. So we start 2022 with the impending threat of the Omicron variant. I just want to go back to a topic I touched on briefly on Wednesday, and that is a recalibration of our dashboard and the importance of statistics as we move into the third phase of the pandemic. What statistics are more important now? What statistics need to be in the background? And this is as a result of global trends in reporting, taking feedback from citizens and also feedback from ladies and gentlemen of the media. So we are going to be rolling out a new dashboard very soon. I will have it now put up on the screen just to run it through briefly. So on the new dashboard, the main statistic now is vaccination status. We are going to be popping on the top right-hand corner in purple what is our fully vaccinated population, 47.5. And then the green and blue bars will tell you how much of the population is fully vaccinated and not fully vaccinated, and then we tell you how many people have been administered boosters. This is now the key variable around the world that governments, public health officials, and populations are looking at. So we thought we'll highlight that. We will also be given in the new dashboard new positive cases for any day, deaths reported, total active positive cases. We'll also be given total patients hospitalized. But now we're going to be graphically representing some information that we used to give as a line item. But we are now going to highlight this because this is important. We'll be given in pie chart formula patients by vaccination status from a certain date to a certain date. Not fully vaccinated, and in this case, this was up to 28 December. You will see 12.5%, not fully vaccinated, 87.5%. And these are persons who will have passed through the hospital and step-down facilities. The main reason that governments and public health officials around the world are readjusting reporting is to show the clear disparity between the vaccinated and the unvaccinated. Lastly, we'll now be reporting in a much more easier manner the total deaths to date, which will give 2,809, for example, but now we'll now be given it by vaccination status as at a particular date. So in the green, you will see those who are fully vaccinated, and then in the other bar, the gray bar, deaths prior to 24th May, because this is when we started our mass vaccination program. And again, the evidence is clear that vaccination saves lives. So we're going to start this soon. We are also going to be giving you some supplemental information that used to be in the original dashboard. And if you could have it up on the screen, so that those who were accustomed to the granular details, you will still be getting it, but not on the dashboard. You will get it as supplemental details. Right. We'll still be giving you all of these details as to how many people tested positive, the comorbidities for COVID-19 deaths. We'll still be telling you about patient recoveries, how many tests are being done. That information will still be given out, but in a supplemental sheet. We will still tell you where the patients are, the different hospitals, and so on. We will still be telling you total persons vaccinated with 1 dose of a 2-dose regime, so don't be afraid. All of these details that used to be highlighted in the original dashboard, as we rejig for 2022, we are following and taking feedback from persons in the community, in the media, and looking at what are the new data sets that need to be emphasized while still giving the details. So this is where we are this morning with our vaccination status. And I just want to encourage everyone for 2022, as part of your New Year's resolutions, to make a commitment to become vaccinated. Before I close, I just want to give you the global picture. Because as we go into the 3rd year of this pandemic, it is not over by any means. Globally, there are 290,859,963 cases. We'll be touching the 300 million mark very soon. Deaths, unfortunately, 5,462,397. And the spike due to Omicron cases, we have never seen these numbers since the start of the pandemic. There are now 42 countries with 1 million cases and above. I'll just give you some vaccination statistics globally to show that vaccinations are being used globally, and we encourage people to be vaccinated. To date, there have been 9.2 billion doses of vaccines administered around the world. 58.3% of the world population has had at least 1 dose, but this is the problem that the globe is facing. 8.5% only in low-income countries have 1 dose. And this still speaks to the issue of vaccine inequity. And it is this vaccine inequity, which we don't have in Trinidad and Tobago, and we should be glad about that, that is driving the emergence of new strains, of new variants. So as the old saying goes, no one is safe until everyone is safe. Just to end, WHO had tasked and challenged every country in the world to fully vaccinate 40% of their population by the end of 2020. We had reached 40% in September, but as you know, we started to crawl. We are currently at 47.5, if memory serves me correct, 47.8. So we have met our global commitment to vaccinate at least 40% of our population according to WHO's directive. But we can do a lot better. And as I close, I just ask everyone to make a New Year's pledge: get vaccinated. Thank you very much, Al.
Thank you very much, Minister. We will move to the question and answer segment, where we invite members of the media to pose questions to the panel. Our media representatives are asked to state their name and the name of their media house before posing their questions. We'll take 2 questions per media house during the first round of questions, and we will field additional questions from the media once time permits. Kindly pose 1 question during all other rounds of questions. We will start with Guardian Media Limited. Guardian Media, good morning.
Hi, morning everyone. Rashad Khan, Guardian Media, and Happy New Year to everyone on the panel. Both my questions this morning are for both of you all on the panel. Firstly, we saw the unfortunate passing of one of the ministry's spokesperson for vaccination who would have died from COVID-19. And now there are some questions in the public's mind about, this person was talking about taking the vaccine and still managed to die from COVID-19. So what message do you have for the public that might be questioning that? And my second question is, Dr. Richards would have raised the point about you're expecting an increase in cases early this year. Can you all quantify what type of increase it is that we're expecting to see? What preparations are being put in place? And within that, now that we've had the two non-travel Omicron variants, are we at the point where we could classify it as being community spread within our population? Thank you.
Thank you, Richard, and thank you for the Happy New Year greeting. Yes. So let's address the issue of Kenny. Yes, he has died. Condolences to his family. The promise of vaccinations, as we said from day one and globally, is that you have to take the issue of vaccinations in the context of what the person's overall health status is, what comorbidities they have, etc., etc. As we have said, the CMO has said, everyone who has come onto this media conference platform to talk about the promise of vaccinations. The promise of vaccinations are threefold. One, they significantly reduce your chance of contracting COVID. No one has ever said it eliminates your chance. Two, it significantly reduces your chances of needing advanced care. It doesn't eliminate it. And three, we have always said it reduces your chances of dying from COVID. So that was always the promises of vaccinations around the world. As we have said and we have reported, and if we could put up the graphic that I had, the new dashboard, because Richard, you asked a very important question. If you could put back up the dashboard, please. We have always said that the percentage of persons dying who are fully vaccinated, yes, if you look at it there, the last bar, the green, when you compare that to the blue, which is the persons not fully vaccinated who have died, that is the promise of vaccinations. So deepest condolences to Kenny's family, but the promise of vaccination is to significantly reduce your chances of dying from COVID. It will not eliminate or bring it down to near zero. And these figures are a clear indication that vaccines, in fact, do work. I will now turn you over to Dr. Richards.
Good morning, Richard. Thanks for the New Year's Day greetings and all the best to you and your family. You asked a very important question regarding the preparation for the Omicron, the arrival of the Omicron variant and the increased number of cases. The Ministry of Health continues to allocate resources to increase the number of beds. But of course, I would like to stress that resources, especially human resources, continue to be very limited. We continue to be stretched. And that's a term that our CEOs and our doctors have asked us to use. We are continuing to look at increasing or operationalizing facilities for low acuity and medium acuity patients. ICU and HDU continue to be a challenge. We have increased our vaccination drive. There are boosters that are now available, but the onus is on the population and on our public to have and exercise responsibility, especially as per vaccination and the advice provided by the health team. Thank you very much.
Thank you very much, Dr. Abdul Richards and Minister. We now go to Power 102 for your two questions.
Good morning, Sparkle McIntosh, Power 102. Both of my questions are for Minister Dayal Singh. Minister, what is the status of the digital vaccination cards as promised several months ago? And secondly, how does the ministry reconcile agencies requesting employees to submit proof of vaccination? Isn't that considered a medical record that is supposed to be confidential? Thank you.
Thank you. So the issue of the digital vaccination card, as you know, is one that is being led by Minister Bacchus. and I will wait for his pronouncement on that. Also, Minister Young would have given an update at the Honorable Prime Minister's press conference a couple of weeks ago. As we stated earlier, there are two parts to this. One, the actual platform solution, which I indicated is already running, and then data entry. So as soon as Minister Bacchus gives us the all clear, we will launch it. On the issue of AG and legislation and medical records, I will let the Honorable AG speak to that, but just to let you know that as a child going to school, you do have to produce your vaccination status to get into school. When I went back to university as an adult in 2007, I had to disclose my vaccination status because I was being readmitted into the Faculty of Medical Sciences, and I had to get certain vaccines, hepatitis B, Mariam, you could remember which ones? Meningitis, and you have to disclose that. So let's wait until the legislation comes around. So I hope we have answered your two questions.
Thank you very much, Minister. We will now go to take questions from the Express.
Good morning, Kim Bodram from the Express. Happy New Year. Wishing health and peace and prosperity to everyone this year. My first question, Minister, there's a recurring issue coming out of the public with the unfortunate deaths we are seeing, but relatives of these people are saying they want to know what is the procedure to reclaim the bodies of their loved ones, because many stories of people going in, testing positive, being sent to a treatment center, relatives are not clear where they are for some time, week or two, little or no contact, and then they are told your relative has passed. And then another series of trying to reclaim their bodies, etc. Can you address that, what the actual procedure is? Also, maybe Dr. Abdul Richards could put some kind of clarity on this, given the behavior of COVID. Some members of the public are acquiring home testing kits. I don't know if anybody purchasing any here, but probably bringing them in when they travel, etc. And we're getting some stories of within a week or two, people are testing positive on their home kits, and it's a fairly reliable indication you may have COVID, but then testing via PCR within the required time, getting negative, then getting positive again on home kit, then negative again on PCR. Of course, PCRs are costly. Is there any kind of clarity you could put? This is happening sometimes within a week or two, and it's chaotic. Any kind of clarity you could put on situations like that, how persons should act? Because they're being advised, get your PCR, but if you test positive on your antigen, it's a good indication you have COVID. I hope I was clear there. Thank you.
Thank you very much, Kim. So let's deal with the first issue. What we are noticing across the system is that some persons who are trying to get information on either patients or persons who have deceased are in fact not entitled to that information. It may not be the next of kin recorded on the admission sheet. That is some of the issues. I do take note of the other issues, and I have sent that to the CEOs over the weekend to address everything from communicating with patients to this very same issue that you have raised, because we have to ensure that the authorized next of kin be told where their loved ones are and to be treated as humanely as possible. So that's that. On the issue of home testing kits, coincidentally, Mr. Faz Khan, who heads up the Chemistry, Food and Drugs Division, was in the office this morning, and he assures me the process to get approval for home kits is a simple one. We just ask importers to just submit your documents to Chemistry, Food and Drugs, and they are committed to turning around this in the shortest possible space of time. The issue you have raised about multiple types of results with home kits is an issue with home kits around the world, where you get variable results as to positivity and negativity for a variety of reasons. One, whilst the kits are inexpensive and fast, they are not as accurate as a PCR. Two, they have noticed in trials with these kits that they get much more accurate results when the kits are when the swabs are properly used or used by a professional as opposed to a person at home who may be in a rush. The other issue with home kits is that they are good for testing the symptomatic persons, and if you get a positive, you could rely on it. But the issue is, if you get a negative test, you need to have that confirmed by a PCR. And that is the global practice around the world. These kits do have a place, but as you have quite rightly said, there is a variability due to a variety of factors that I have just described. In the Trinidad and Tobago context, we have used 180 rapid antigen tests throughout the system. So that is where we are with home testing kits. I've spoken about the accuracy of them, and if you have a negative test, the issue with home test kits is that you get a high degree of false negatives, and a false negative is much more dangerous than a false positive, and that is why persons with a negative test with a home kit should have it validated by a PCR test. Okay, Kim, thanks for your questions.
Thank you very much, Minister. And we quickly move to AZP News. We're ready for your 2 questions. Good morning, Happy New Year.
Good morning, Priyabi. Harry, AZP News, Happy New Year to all. I just wanted to follow up a bit on Richard's question about the Omicron variant. Is it the dominant variant now? Because we see it spreading, doubling in within 2 to 3 days elsewhere. So, what is the rate like in Trinidad? Do we have an idea? And my second question, Dr. Richard says that, you've always said that people present themselves very late to hospital. AZP News, spoke to a few people who basically said they don't have the confidence in the public health system and in the private healthcare system. And I want to ask Minister this question, Minister, do you think that's something the ministry needs to do to sort of enhance and to give people confidence in the system so they'll present themselves when they need to do? Thank you.
Good morning. Thank you, Priya. As of now and as of today, there are 12 cases of the Omicron variant in Trinidad and Tobago. The variant is not in community transmission as of today. However, the Ministry of Health continues to do testing and to monitor the situation with respect to the confirmed cases of the variant. And in the event of additional cases, we do provide all information that we can via the press releases. So, in short, there is no community transmission of the variant at this point in time. However, we do notice changes as we've had with other variants, and we will provide that information to the public once there is confirmation of additional cases or spread. Your second question is very important and key. And yes, we recognize that it may affect the health-seeking behavior of our population. You would have indicated that there is a perception regarding care in the parallel healthcare facilities and at the accident and emergencies. We would like to emphasize that all our protocols and SOPs are based on World Health Organization guidelines. We have dedicated specialist teams with equipment such as ventilators and dialysis machines. We have specialist ICU care nurses and other senior nurses, testing apparatus, and all the supporting resources available in the accident and emergencies and the parallel healthcare system. In the event that you are at home and you require oxygen care, oxygen therapy, and we've noticed that this is, a practice that we have seen, especially over the last 3 months. Your best chance is being admitted to a hospital facility where you will receive the required care from the specialist team and where you have access to ongoing testing and diagnostics, as we would say, as well as ventilatory support, that is ventilators, cannulas, and oxygen as required. We would like to once again encourage the population to please seek care early when you may be at a ward level situation requiring oxygen, possibly just by a face mask, and where you are conscious, as opposed to seeking care when you are at a high dependency unit level or an intensive care unit level. This is the only chance that you or your relatives have with respect to treatment for COVID-19. Additionally, the Honourable Minister would like me to highlight this morning the use of ivermectin, or I should say the misuse of ivermectin, thanks Minister for that reminder, by private physicians. Please, this is not WHO approved. This is not according to our treatment protocols. And we have seen negative consequences. We have seen persons die, present late. It is registered on their notes and confirmed that they used ivermectin, and the outcomes have been very poor, creating a lot of grief and distress to their relatives, who in many cases said they should have known better or regret the decision to go that route. So please, I'm speaking here not just based on statistics alone, but on the conversations that we have daily, the Honourable Minister, the CMO, myself, with our teams at all our facilities. These are consistent trends. And please have some confidence in the parallel healthcare system. We continue to try our best.
I just want to come in here a little bit prior, because you asked a very important question. On All Year's Day, I convened a meeting with the TTME, a couple other private sector physicians, and doctors from across all 5 RHAs. And they again raised the issue of patients taking ivermectin at home. It is becoming a very serious problem. And you use the word confidence. It is difficult to understand why patients will have confidence in ivermectin. And when the ambulances reach home by them, as Dr. Richards has said more than once, because they feel ill, and then an hour later they may feel a little better, they tell you, come back. I am on ivermectin. I have taken an ivermectin pack, which is ivermectin plus vitamin B and vitamin C. We are asking everyone to discontinue the use of ivermectin. Put your confidence in WHO approved protocols and come into us early. The earlier you come in is the lower level of care you need and the better outcome you will get. But when you wait too late and the ambulance goes 2 times, 3 times, your chances of having a good outcome are severely lessened. So prior, I really want to appreciate the fact that you raised that issue, and people need to put their confidence in the science and not in ivermectin, vitamin B, and vitamin C. Thank you very much.
Thank you, Minister. And Dr. Richards. Newsday reporter was having some technical difficulties, so they have sent in the questions. First, what's the status on finding a new location for storage of COVID-19 deceased bodies and the situation at RHA Mortuaries and Forensic Sciences Center with the bodies of COVID-19 deceased? Second, what is your view about police officers being told by their union not to disclose their vaccination status, and has vaccination increased in the public sector ahead of the mid-January compliance stated by government? What's being done to increase vaccination?
Yeah, thank you. So any questions to deal with police officers, forensic sciences complex, I think should be directed to the line ministry, which is the Ministry of National Security. On the issue of storage capacity, Mr. Keith Belgrove spoke to that issue. That is a private sector issue. And if I remember his interview on one of the TV stations last week, he said he's looking for an alternate site, and I will continue to liaise with Mr. Belgrove. The position at our morgues at this time is not critical. There is space, but we are also always engaged in a contingency planning with the private sector via Mr. Belgrove, who is president of the Funeral Homes Association. Thank you very much.
Thank you very much, Minister, for that.
Oh, sorry. They asked about uptake of vaccines. Yes, sorry. Yes. So as I reported last week, there has been an uptake of first doses. We were starting to see figures like 1,004 per day, which is the 2 Sinopharm, Pfizer, and J&J. And I indicated at that time we hadn't seen these figures since about October 18 for about 2 months. I don't have it disaggregated by where people work, but the more people get vaccinated, the happier I am. People just come out and get vaccinated. And I am hoping that this uptick that we saw not only continues, but also increases, right? As far as the public sector is concerned, I would have made 2 sites available to the public sector from today to make it easy for them. That's my job. One at the government campus building, and 2 separate dedicated lines to public officers at SAPA. So it's there for them. Come out and get vaccinated to save lives. That is the main message I could give you from the Ministry of Health. Thank you.
Thank you, Minister. We now go to Guardian Media Limited for your follow-up question.
Hi, morning again. Minister, I just want to follow up to one of your responses you would have given there about the testing kit. So just to clarify, is it then that importers are free to import testing kits, these home test kits, and submit it for approval, and we could see that being incorporated into our landscape locally?
Yeah, thanks. Yeah. So as I have indicated, don't import it yet. Just get the approval and then import it. In speaking to Mr. Fascan this morning, as I've indicated, it's a very simple process. And he indicated once the kit is registered in their home country of manufacture, that is basically all they'll look at. So it's a very simple process, and we just ask all importers. We have made it as easy as possible. We want to encourage home testing, but there are caveats to home testing as I have described, especially if the person at home does not take the swab properly, and 2, if you get a false negative, or if you get a negative, it needs to be validated and backed up with a PCR test. That is one of the disadvantages with home rapid tests, the high percentage of false negatives. Thank you very much, Rashad.
And thank you, Minister. We go to Express for your follow-up question.
Good morning, Kim Boudram again. Minister, is there anything you could say about the issue of Hindus wanting to return to open fire cremations? It's been a bit of a social issue recently, and voices were raised. We know this is tied to government and health regulation and policy. What kind of update can you give to that community on that issue?
Yeah.
Thanks.
Thanks very much, Kim. So the update I can give you is that this matter is before the courts, and the necessary affidavits are being prepared to submit to the lawyers. Other than that, it will not be responsible of me to speak to a matter that is before the courts, but we notice we have not turned a blind eye or a deaf ear to the concerns, and we will take all those concerns into consideration. Thank you very much.
Thank you, Minister, for that clarification. And we go to Power 102 for your follow-up question.
Sparkle McIntosh, Power 102 FM again. There are reports reaching our newsroom of elderly persons dying in tents while awaiting admission at the Cooper facility. Minister Diyal Singh, can you please comment on this? Thank you.
So there are no tents at the Cooper facility. So maybe Dr. Richards can take this one. There are no tents at the Cooper facility. Is a hospital, and then we have the field hospital, right? So.
Yeah. Thank you, Minister. We acknowledge your concerns about persons dying in tents. The accidents and emergencies have expanded their capacity to treat persons, given the increased number of cases that we would have noticed from October, to isolation units and biocontainment units. This is across all of our RHAs, and the relevant level of care is administered in these additional facilities at the RHAs. Again, we have noticed that many of the persons who are succumbing to COVID-19 in the accident and emergency departments, and really they would be ICU, HU level patients, are not fully vaccinated. So in terms of the elderly, being elderly is an increased risk factor, is a risk factor for an adverse outcome or for a complication that may lead to death. So we are asking persons once again to please ensure that they are fully vaccinated as per the Ministry of Health and WHO guidelines to reduce the risk of them coming to the accident and emergency facilities. Thank you.
Thank you very much, Dr. Richards. Guardian Media Limited, you have another question? We're ready. Guardian Media.
All right, thank you. Yes, morning again. Minister, since the announcement was made about the public service becoming quasi-safe soon, are you satisfied with the response we would have been seeing so far in terms of vaccination uptake?
Thank you, Rashad. So as I indicated, I just gave the figures as to the sort of increases we saw in vaccination rates. And as I indicated, I don't have it disaggregated by public officers or whatever. There has been an increase, a significant increase, but a significant increase from a low number. So I'm not getting carried away with the percentage increase, but I'm happy for it. We are averaging now, last week, 14, 15, 1,600 a day. Those figures we have not seen since middle of October. So that's a good sign. But we could still do a lot better. And as far as the public officers are concerned, to make it easy for them, we have set up 2 separate sites for them. One at the government campus plaza in Port of Spain on Lower St. Vincent Street, I believe, and 2 separate dedicated lines at Sapa. So we ask them to come out, get vaccinated, bring your family, bring your spouses, bring your kids 12 to 18. Our goal now is just to vaccinate people. At the Ministry of Health, we just want people to be vaccinated. We are currently at 47.8% fully vaccinated. Let's make a commitment to get it up to about 50% ASAP, and then we take it in increments there. A 50% rate reaching 700,000 persons will be a nice psychological barrier to break. We have been crawling towards it. Let's make that jump. Let's reach there and then take it forward. Thank you very much, Richard.
Thank you very much, Minister. Ladies and gentlemen, we are at the end of today's media conference. We thank the media presenters and you, the listening and viewing public, for your participation today. We encourage persons to include their 2022 resolution to practice the health guidance by wearing your mask, washing your hands, social distancing, vaccinating, and getting your booster when it becomes due. So that will be all for now, and thank you very much for your time. Goodbye for now.
I solemnly pledge to dedicate my life